We now invite everyone for a roundtable discussion. We would like to remind everyone that if you do not speak Portuguese, that you go in the back as soon as possible, and you can get one of the translation device. We would like to also thank Sula and John Jensen for their kindly time here with us doing the translation, this work with us. We will introduce Dr. Claudio Petrillo, and he will be introducing each of the participants of the roundtable. As he call and announce each participant, we ask that each participant come and join us up here. Dr. Claudio Petrillo, board-certified physician in physical medicine and rehabilitation. He completed his residency training and a fellowship in spinal cord injuries at New York University Medical Center's Rusk Institute of Rehabilitation Medicine and served as clinical professor at NYU until 1982. He was the chairman of the Department of Physical Medicine and Rehabilitation at Norwalk Hospital, Norwalk, Connecticut, from 1982 to 2012, and has been recognized by his peers as one of the top doctors in the New York metro area for 10 consecutive years. Married to Dr. Sylvia Knoplock, who is here also with us, in 1981, they have been partners professionally and in life. Claudio and Sylvia currently have a practice of integrative regenerative rehabilitation in Norwalk, Connecticut. Except for scientific medical articles and book chapters, Dr. Petrillo had never written a book until 2007, when he began to channel eternal bonds of love from his son, Ricardo, that had passed away at age 20 in 2005. Ricardo, Claudio, and Sylvia have since published 8 books. We now invite Dr. Petrillo to the podium.
Thank you very much for the introduction. I'd like to thank Sonia and Cicero for the invitation and for the organization. And I'm very happy to be here. I don't like to miss any of these meetings. They are very enlightening. The title of my talk is Integrating Soul and Body in Diagnosis and Treatment. Interestingly, yesterday and this morning, we heard a lot about research, data, statistics, which, talking to a biased audience, I'm sorry to say that, just reinforces our beliefs. Just preceding me, Dr. Fenwick gave an inspirational talk. And I think the purpose is now to go on our own experiences as clinicians and how we deal with spirituality when facing our patients. This is who we are, and I say we because Sylvia and I have been partners in everything we do. We actually have had this training at the same institution, New York University, in rehabilitation medicine. Obviously, I was there much before she was. And we currently practice physical medicine and rehabilitation. We like to call it integrative, spiritual, physical medicine and rehabilitation, and where we try to do holistic care, but based on philosophies that we've been acquiring together for the last several years. The scope of our practice includes all these above diagnoses, which are the reasons why patients come to us. They don't come for spiritual healing, they don't come for nutritional counsel, they come for back pain, for a paralysis, for a spinal problem, for osteoarthritis of the knee. And obviously, a patient that comes to the office with knee pain and requires basically treatments topical to improve the pain, we're not really going to go over and expand our views into a spiritual realm. Now, I'd like to talk a little bit about Larry Dossey because he, first of all, he was the creator of the term non-local consciousness. And in 1991, he published this book, Reinventing Medicine, Beyond Mind, Body to a New Era of Healing. He's been one of the greatest innovators of spirituality in this country and the world. In that book, he defines 3 eras of medicine. Era 1, mechanical medicine. Era 2, mind-body medicine. And Era 3, non-local mind or no-local consciousness. In Era 1, what matters is energy and matter, not mind. The treatments are drugs, surgery, radiation. This era started actually early in the 20th century, and it created monumental advances in the history of healing with a tremendous change in life expectancy and apparently quality of life. We had public health interventions, vaccines, antibiotics, etc. Era 1 is quite effective in managing acute disease, but totally ineffective in combating chronic, degenerative, and age-related illnesses. The services we provide in our practice include, those are the Era 1 services we provide, including some very state-of-art therapies, which is stem cells injections for osteoarthritis and other diseases. But basically, we cover a scope of diagnosis and procedures. We also, for a couple of decades, have been utilizing Era 2 alternatives, such as psychotherapy, chronic pain support groups, relaxation, stress management, nutrition, exercise, lifestyle modification, and integrative medicine. Integrative medicine is a new science, relatively new science, started probably, I would say, a decade ago. And it's the practice of medicine. What in summarizing is adding the allopathic component of medicine to everything else that is shown to have contributed in many different cultures to improvement of health. One example of widely accepted effects of Era 1 and Era 2 medicine is the treatment of heart disease, in which we use medication and drugs in conjunction with stress management, and it's scientifically shown to improve quality of life. We know that emotions, attitudes, and thoughts profoundly affect our bodies and our health. This is known for centuries, and we only now are beginning to gather some advances in the mainstream of medicine in the United States. 2,500 years ago, Plato already came with some of the problems that are current at this point, and he continues to be. The great error of our day is that physicians separate soul from the body. So, according to Larry Dossey, Era 3, or non-local mind, that is the 21st century challenge. Or, as the subject of our meeting here, the dawn of a new era. Era 3 involves non-local mind, telepathy, clairvoyance, precognition, visions, prophetic dreams, distant healing, intercessory prayer. I want to present our personal experience to you in our practice. And although it's a very unique practice where both partners share virtually all ideas and concepts, and we have been able to separate ourselves to the mainstream practicing trends of this country, which don't allow time with patients. And our experience changed and was very transformational in 2005 when our son Ricardo passed away in an accident in college at age 20. We talked about transformation experiences. And I have no doubt in my mind that the most common transformational experience that we all have, we all go through, is pain. It might be a psychotic stage, but I had a feeling of somebody squeezing my heart. Was that delusion? So we have an opportunity when going through that to go either way, to make that as a positive experience or make it as a negative experience. We all know that. It happens to us, it happens to all of you when you know people that have gone through this experience. We have a choice then, without having to have an out-of-body experience. We know that basically our beliefs held us together and held our families together. We had to change the way we lived. We had to venture into new fields. We decided that we would apply ourselves to the study of spirituality in an intensive basis and dedicate our lives to that, as well as to our practice and to our family, having to make a lot of adjustments on our lifestyle, simplifying everything in order to accomplish that. One of the things that enlightened us was that less than a year after Ricardo's passing, we received a first message for him, almost stuttering. And then a second one a few weeks later, and then a third one. And in May of 2008, less than 3 years after his passing, we published the first book, Eternal Bonds of Love, which is his report of what happened to him after he passed away. We continue in communication, constant communication with him. And 2009, we published 2 books. In 2010, a 4th book. And we going on with that, and hopefully will never end, because that is what keeps us alive. The last book published was Two Worlds Intertwined, just published about a year ago. We are never going to see our patients the same way we did before. We're never going to see the world the same way we saw it before. That's the transformation we have. What I'm going to do is to present a case, and one case, and that's Dr. K, which is Dr. Knoploch's patient. Her initials MV, I'll refer to that. And she's 42 years old. Came to the office with diagnosis of chronic pain syndrome since age 18, affecting the left side of her body. She had various unexplained symptoms, severe chronic fatigue, and had seen multiple specialists with no conclusive diagnosis. She's been sexually abused as a child by a stepfather. She was in an abusive relationship for 15 years. She left home at age 14 to live with a 27-year-old man. She had chronic depression. She was Catholic and a regular churchgoer. She presented a repetitive, frequent nightmare since childhood. An evaluation, she presented a large bluish birthmark covering around the left eye, covering most of the left side of the face, and it was a very distressing factor in her life. The diagnosis at the time was fibromyalgia syndrome with significant psychological components due to emotional and sexual abuse. Now, in the first visit, Dr. K asked, "What happened to your face?" Because it really looks like she was traumatized. She suffered a trauma. And she said, "This is a birthmark." "Oh, I'm sorry to have asked." "No, don't be sorry. This is so common. I was bullied all my life as a child because of it. I hate myself. I hate my body. I hate the way I look." The initial treatment consisted of physical therapy and home exercise program, medications, mostly antidepressants, meditation and relaxation techniques, diet and nutritional counseling, she was overweight, vitamins and supplements. With time, the patient began to confide more in Dr. K and tell her more detailed facts about her history. Her mother knew about her sexual abuse and was then living in Puerto Rico with the stepfather. MV visited him yearly, and she dreaded to go. So a month before her scheduled visit, she had all kinds of symptoms, nightmares, anxiety, GI symptoms, etc. As her trust increased, Dr. K started to ask about her beliefs. And she said, "I believe in the devil and that this is not our only life. What do you think?" For which Dr. K answered, "I don't believe in the devil, but I know this is not our only life." She told MV a little bit about our story and gave her the first book, Ricardo's first book. A few sessions later, she came back and said, I couldn't put the book down, as it explained a lot my situation. With time, Dr. K was able to give her a copy of Allan Kardec's Spirit's book. And good part of the medical visits from then on were a discussion of spiritual aspects related to her illness, but not until she gave her a copy of an article in the Explorer done by Larry Dossey, Explorer magazine, which was a summary of the tremendous, monumental work of Jan Stevenson, that she suffered the biggest transformation. She said, "This is the most important thing you've done for me." She's finally in peace with herself regarding her birthmark. She's currently in a steady relationship, has a 5-year-old daughter, has forgiven her mother and stepfather. She's no longer depressed, she's sleeping better, improved diet, exercises, continues to study spiritual books, and has an acceptance of her birthmark as a proof of reincarnation. So what is our take from that? First of all, I have to be mindful when to begin to explore spiritual counseling with our patients, because many of them will not accept from the beginning. Then there was a 3-year wait until Dr. K felt comfortable in opening up, taking the input from the patient, from her spiritual guides, and from the patient's spiritual guides. There was a significant opportunity of synchronicity there. I remember that because we were reading that article, that Larry Dossey's article about Jan Stevenson in our daily readings. And she said, "I'm going to give a patient of mine this article." That's called synchronicity, and that worked perfectly on that side. We have heard a lot about training and taking a spiritual history, but applying that information to clinical practice requires experience and trust, not only on our spiritual guides, but also the patients. Then the universe will smile. Thank you very much.